So today's presentation is going to be all about colic, and myself and Dr. Abbott have tag teamed this. We have a ton of experience with colic, pretty much the most common emergency that we see. So we're going to tell you our tips and tricks and what we've learned over the years, and hopefully you can learn something tonight. So for those of you who have not met her, this is our newest addition to the team, Dr. Megan Abbott, and she has started working here as an associate, and she's going to give the first half of our presentation tonight. So, Dr. Abbott.
Thank you. All right, can everyone hear me? Okay. So first we want to thank BI, the rep that has provided your wonderful goodie bags and is doing the little raffle at the end of our presentation today. They've been generous enough to sponsor our talk tonight. So we're going to kind of start off just with like a general overview of colic and what you can expect.
I don't think you've got your mic on.
I do have my mic on.
Are you sure? All the way?
Oh, now, oh. All right, now it's really loud. Okay, wait. Turn me down. Okay. So, all right, so we're just going to do a general kind of overview about colic, what signs you can expect, kind of all the things you as horse owners are will expect to see or know when you need to give Dr. Ferguson, Dr. Latcher, myself a call, and when we need to see your horse. So, So first, let's kind of define what colic is. Everyone kind of assumes that colic is always gastrointestinal pain. That's not necessarily the case. It kind of manifests as that. So basically, it can be signs or symptoms that are abdominal pain, but may also not be caused by abdominal pain. So we're going to kind of do a little quiz for y'all. Based on a show of hands, how long is a horse's gastrointestinal tract? If you think it's A, 30 to 40 feet, raise your hand. If you think it's B, 50 to 60 feet. Okay. C, 80 to 90 feet. Okay. And D, 100 to 110. Okay, perfect. So the answer is 100 to 110 feet. Yep, a lot longer than what you would expect it to be, right? So now, kind of the parts of the gastrointestinal tract. Starts at the mouth, then we have our esophagus, the stomach, your small intestine, your cecum, your large colon, small colon, rectum, and anus. And now we're going to do a little interaction with y'all. It's going to be fun. Probably wondering why there's this random rope sitting up here. We're not going tree climbing. I don't do that. That's Dr. Latcher and Justin. That's not me. So I'll start. Actually, who wants to volunteer to be the mouth? Why don't you come up here? Perfect. All right. What's your name? Anna. So Anna is going to be our mouth, and she's going to hold this end of the rope for me. And this is our esophagus to this white line. So this is about 4.5 feet long. Okay, you can turn around and face them. Okay, and so then we'll have this other little section here. We're going to kind of consider our stomach, which we don't really have a measurement for. It's, kind of a round ball. So then we go into small intestine. This is the fun part. So I'm going to have, you'll hold that. Okay, I'm going to have you hold that. We're going to kind of just work our way down here. We're going to flip it this way, sorry. Okay. Now you hold that part, and you can hold, getting stuck. But, okay, so this is a perfect example of what can happen to their GI, right? It gets stuck, it gets twisted. It's not surprising when your small intestine is 70 feet long. Hold that there. Hold that. Still going. We're going to be going for a while here. Oops, sorry. Keep going. There you go. All right, we're getting there. Slowly but surely. Not really sure how I'm going to get back up this, but that's okay. We'll figure it out. I'll start jumping. That's fine. I did a lot of that when I was little, so we're good. All right, so here we are. We're at the end of our small intestine. We're at the end of our 70 feet. So then we have this little guy over here. He's about 4 feet long. This is our cecum. He kind of hangs out off on the side, and our small intestine and our large colon attach at the cecum. He just kind of hangs out. So then we're going to keep going here, and we'll start going back up this way because that's all. And then you got this whole long guy here, all the way to your white tape up there, and that's going to be your large colon, small colon. That's your whole hind gut and your rectum. So if you can imagine all this shoved into your horse, that's a lot. And you can kind of see how it's very easy for things to get twisted, things to get inflamed, things to just kind of not really do what they should do when there's stuff everywhere. So that's that. I will steal this back from you. Thank you all to my volunteers.
You are the rectum.
Thank you, thank you. Thank you. I appreciate all of you for helping with that. Thank you very much, little mouth. That was very helpful. Thank you, Justin. So, let's talk a little bit about what you all might see if your horse is acting colicky, right? So you may see that your horse is anxious, walking around, pacing their stall, not really acting like their normal mellow self if they're a mellow horse, or they may be very depressed. They may be hanging their head down real low. They may be kind of not interested in what's going on and just not acting like themselves. You may see your horse pawing. Now that can be really frustrating because some horses like to paw. But if it's not something your horse normally does, or it's not something that, it's not dinner time and they're like, okay, feed me, and they're pawing, that could certainly be a sign of colic. You may see them flank watching. So what this is going to be is they're going to be standing there and they're going to be turning their head back and looking at their hind end to one side or the other, maybe both sides. You may see them rolling. A common misconception is that horses have to be rolling to be colicking. That's not the case. They do often roll, but they also will sometimes just get up and lay back down and get up and lay back down. So if you're seeing your horse do that, they're probably having some sort of colic or abdominal pain. The phlegm response, which you'll see your horse do if they smell something funny. This is what this horse is doing in the picture here, but they also might be doing that if they're colicking. They may not be interested in eating. They may, go out, take a bite of grass and be like, I don't really think I want that. Or they may start to eat their grain, eat a little bit of it and be like, yeah, I don't really feel like that's going to work out well. You may see them stand out to like they want to urinate, so that's called parking out. They may just try to do that, they may stand like that, but they may never urinate. And then if you have a stethoscope, you might be able to take their heart rate. If their heart rate's elevated, that's a sign of colic, that's a sign of pain. Anybody know what a normal heart rate is on a horse?
30.
So 30, somewhere in the 30 range is good. We like them to be below 40. So if they're up in the 42, 45 range, we don't really get too concerned. It's when they're up in the 50, 60 range that we're like, something's off, something hurts somewhere. And you may see them tremble. So that's definitely a sign of pain. If you've ever seen a horse that's kind of standing there and their muscles are just kind of shaking and you're like, that's kind of weird, what are they doing? It's definitely a sign of pain. May or may not be colic related. Maybe the horse is, lame on its right hind, and so it's standing a lot on its left hind, and its left hind is trembling from fatigue. But if, there's other signs going along with it and they're trembling, for sure, that's definitely a sign of colic. And then, of course, obviously, if they're not pooping, that's a problem. And we know we all clean up a lot of poop as horse owners. And we know that, if the horse isn't pooping enough, there's a problem. So we're going to go over some types of colic. This video here is actually one that I took on my internship of a horse that was refluxing. So y'all have seen us pass a tube on a horse, right? And most of the time we don't get anything back from it. We're always putting things down, right? But what this video shows is that sometimes you can get a lot of stuff back. If we're getting a lot of stuff back from the stomach, that's probably not such a good thing, and that's called reflux. So if you hear us talk about reflux, there you go. So we can have multiple different types of colic. You can have a small intestinal colic, and you can have a large intestinal colic. Your small intestinal colics can either be strangulating or non-strangulating. So there's like this whole big a bunch of different categories, basically. So what can happen with a small intestinal colic, if it's strangulating, what you have is a volvulus. So you have your intestine that has decided to take itself like this. You got your loops doing the things they're supposed to do, but then what it's done is decided to twist itself on itself. So then what happens is all the blood supply is gone, right? So this whole part has no blood supply. Well, then this part's going to die, and that's not good. You can have a lipoma, and lipomas are very, very common in older geldings. And same thing, those can twist around the small intestine. The small intestine can get all wrapped around, and it can cause parts of the small intestine to die. You can have a hernia, so they can, just like a dog could get a hernia, or you can get a hernia. They can have hernias that either come through the abdominal wall, they can go through the inguinal rings, they can go, if you have a stallion, they can go into the scrotum. A mesenteric rent, so in all of this small intestine, there's a bunch of tissue that kind of holds it together and how it's supposed to be. The tissue can get a hole in it, and then your small intestine decides, oh, this hole looks like a fun place to go through, and then gets cut off, and the circulation gets cut off to it, and so then you have more dead intestine. And you can have an intussusception, which is where part of your intestine, or not your intestine, but your horse's intestine, will go, I got this part here, and this part over here says, oh, it looks fun to go through and be inside this intestine. And so that's, again, cutting off all the circulation and blood supply. You can have small intestinal non-strangulating. So ththese are your ileal impactions. These are the ones we say, when we ask you, what kind of hay do you feed your horse? And we get the answer coastal, and your horse is colicking, this is what we assume your horse has until proven otherwise. Coastal hay is very much known for causing ileal impactions. And it's just part of the small intestine that just does not, for whatever reason, like the coastal hay. Don't worry, Dr. Ferguson's going to talk to you about how you can kind of combat that. Ascarid impaction, so this is worms. But this is going to be in your younger horses. This is going to be in your less than 2-year-old horses. And they can get a heavy burden of these worms that can cause an impaction and can cause your baby to colic. Or you could have a proximal enteritis. So this is an inflammation of your small intestinal tract. This is what this horse in this video had. So what they do is they vomit a lot. But if you can keep ahead of all of the badness and keep them hydrated and all of that, they usually do pretty well with it. Maybe we'll just click. So then, oh yes?
Dr. Evans, did you say that they vomit?
So horses can't vomit, right?
Well, that's what I thought.
Right. No, so horses cannot vomit, you're correct. But what we're doing when we're refluxing them is making them vomit. Right. So all that that's in all that reflux that's in their stomach, they need to get out. And for whatever reason, it's not passing through the back end. So when we pass the tube and we're getting all that stuff out, we're helping them relieve all the pressure and all the buildup of gastric juices and all that stuff get out, since they can't do it on their own. So then we go to the large intestine. So the large intestine, again, can have a strangulating colic, or they can have a non-strangulating. So the large intestine can, again, do the volvulus thing. And that's common in mares that have recently foaled. They can be ones that can get the volvulus. The large colon can also do an intussusception, where part of the intestine goes into the other part. Large intestine can get impactions. This is where we get our sand impactions most commonly. And they can get displaced. So you can even end up with a horse that has like a sand impaction that gets really, really heavy, and the large colon decides it's going to flip over, and then it gets stuck there. I know this from experience. My horse did that a few months ago. That's okay. And then they can also, there's a ligament on the left side of the body that is called the nephrosplenic ligament. It connects the left kidney to the spleen, and it kind of looks like this. If my hand is the spleen, and this is the ligament, and this is the kidney, you got this on the left side of the horse's body, okay? What can happen is the large colon, for whatever reason, decides it wants to be in this little space, and it gets stuck there. There's ways to treat that don't necessarily involve surgery. Again, Dr. Bergeson's going to talk about that. And then horses from kind of out in the California region can also develop things called an introlith, and it's basically a giant rock. These can also be caused by foreign bodies. So if they eat a piece of hay string, minerals and such can form around that and basically make these rocks in their GI, and that can cause things to not pass through. And then, of course, they can have a colitis, which is going to be very painful. They're probably going to be passing a lot of manure, and it's going to be a lot of watery diarrhea, but they can act like they're colicking. They can be pawing, they can be parking out, they can be really, really unhappy, and that can present as a colic. And so then, on the whole other realm of things, horses can act painful and act like they're colicking for reasons that have nothing to do with their GI tract. They might have an ulcer in their eye. They might, be having trouble breathing. They might have a pneumonia brewing or something like that, and they could be acting really depressed, not wanting to eat. They can stand, like, especially with respiratory cases, they'll stand with their elbows out, and so they kind of look like they're parked out. And so you're kind of thinking, ooh, my horse is colicking, but in reality, they're having trouble breathing. Early stages of labor in pregnant mares can definitely look like colic. You'll see them flank watching, you'll see them kicking at their abdomen, you'll see them getting up and laying down as they're trying to position the baby into the right position to be born. But that's all normal in a pregnant mare, but you might think, oh my gosh, my horse is pregnant, she's colicking, oh my gosh, this is a big thing, what do I do? And then horses that choke, they can also very much act like they're colicking. They can stand there with their head down, they can be uninterested in eating, they can't eat, and they just might kind of give you all the signs, and you're like, oh, this isn't good, until you start seeing food come out of their nose, and then you're like, oh, you're choking, got it. So those are all the different types of colic. There's, a bunch more that we didn't really touch on, but basically the most common ones that we'll see. And now Dr. Bergeson's going to kind of go into a little bit more diagnostics, treatment, and all that.
Well, thank you, Dr. Abbott.
Button all the way over.
Yes, it is.
Is it? I tested it like right.
Sit down.
Are we on now?
No.
Oh my goodness. All right, we'll swap. All right, please stand by. Technical difficulties. During this commercial break, I'd like to tell you about J. Boyd Wolf. That was hard.
Okay. That sounds a little better.
Sorry.
Can everybody hear me okay? All right, great. So we're going to go through what you might typically see us doing if your horse has a colic, and why we do it when we come out on the farm. So of course we're going to start with our physical exam as always. We're looking at your horse's temperature, pulse, and respirations. So temperature, because sometimes horses will act colicky because they feel sick, because they have a fever. They might have something else unrelated going on, and again, they're having one of those false colics that's just presenting as abdominal signs. Pulse, as Dr. Abbott talked about, is a really good indicator of pain. So if their heart rate is elevated, that's definitely a red flag that they might have some sort of strangulating or worse underlying cause of colic that we need to diagnose and be on the lookout for. Respiratory rate, definitely. Again, painful horses are more likely to have more rapid breathing.
So we're going to check their basic TPR, temperature, pulse, respirations. And then gut sounds. I think owners are told to listen for gut sounds. There are kind of 3 levels of gut sounds. Really good gut sounds, really too many gut sounds, and really not enough gut sounds. In between there, if you say, well, it sounded normal on the left, but a little decreased on the right, I'm not too worried about that. Also, what side you have decreased gut sounds on does not necessarily correspond with where an impaction is. So there's a lot of reverberation that goes on inside that barrel, that giant drum. So basically, if we listen and hear no gut sounds, that's going to be a red flag because the horse's GI tract should always be moving. Also, if we listen and we hear hypermodal gut sounds, they're hyperactive, they're too frequent and too fast and sometimes fluidic, that could be an indicator that your horse has diarrhea or is about to blow with diarrhea, which can also cause colic signs. So definitely gut sounds are important, but they're not the be-all, end-all, and definitely good practice to listen for gut sounds when you think your horse might be colicking. Once you've called us and you're waiting for us to get out there. And then mucous membranes and capillary refill time. So we always look at horses' gums. The gums can tell us a lot of information. So if the gums are pale, could be an indicator that they don't have good circulation going on at the moment. Also, if they're really bright red or purple, that can also be an indicator of poor circulation. It indicates that the blood is not flowing back to the heart as well as it should. Then we also feel for how dry they are. You want nice, moist gums at all times. If the gums are kind of tacky or sticky when you push your thumb against them, that's an indicator of dehydration, which is usually the underlying cause of colic. And then CRT stands for capillary refill time. So when you push on the gums, you want to blanch that pink away, and it should come back in less than 2 seconds. Again, that indicates that the circulatory system is working well. If you blanch it and it takes 3 or 4 or more seconds to come back, that's an indication that their circulation could be compromised somewhere, like in the GI tract, like if they have a strangulation. Skin tent is another indicator of hydration status. So when you pinch your horse's skin and let go, it should bounce right back. It should be nice and elastic. If you pinch it and it stays tented there for several seconds, your horse is probably dehydrated. And again, could be an underlying cause of the colic. What's shown in the image is transrectal palpation. So we can get a lot of information from this. Now, keep in mind, a human's arm is not as long as the horse's GI tract. So we really can only feel about 15% of the GI tract via rectal palpation. But there's still a lot of information we can get from the back end. So we can diagnose a nephrosplenic entrapment, which is that little cup between the kidney and the spleen that Dr. Abbott talked about. We can diagnose a volvulus or a complete twist of the large intestine. Lots of times we can diagnose an impaction. I describe to my students, it feels like you're squeezing the outside of a tube of cookie dough. That is the consistency of an impaction in the large intestine or small intestine. So that's what we're feeling for in there. Really, in a completely normal horse, you want to stick your arm in and be able to go like this, and there's just nothing you can really grab onto. Everything should be free moving and loose, and that is great. So if we can make out a tube that feels like a full tube of cookie dough, that's a problem. Lots of other things we can diagnose via rectal palpation, but those are kind of the main ones we look for. Impaction, volvulus, or entrapment. Checking for reflux. So like Dr. Abbott talked about, we'll pass a tube and we can relieve that reflux if their stomach is full of gastric juices since they cannot vomit. But that's also a diagnostic tool. So if we pass a tube and we get reflux back, that's an indicator that the stomach is not draining for some reason. So likely there's some small intestinal problem that's blocking the stomach from draining as it should. Okay, so some other stuff you'll see us do as far as diagnostics, or may see us do. These are usually more if we have found a red flag on our physical exam, we might pursue further blood work. A lot of these things we can do on the farm. So packed cell volume or total protein, that's mostly an indicator of hydration. So we want to know whether or not your horse is dehydrated. And it's also a really good prognostic indicator. So if you bring your horse in the clinic and it has a really high packed cell volume, we know that there's not a good chance that IV fluids are going to resolve that, and it may require surgery. So lactate is something we can do on the farm. So this looks like a glucometer, but it's actually a lactate meter. Works exactly the same way though. We just get a drop of blood from your horse, put it on the end of the little strip there, and it reads it almost instantly in about 10 seconds. So this is something we always carry with us and can do stall side. So it's a really quick test, and there's also really good research behind it. So less than 2 is normal, and then if you get 2 to 4, that's kind of the middle of the road range where it tells us there's something more going on and your horse might need some more intensive medical management, such as IV fluids. It might not just be a simple colic that resolves with tubing one time on the farm. So that's where we'd probably recommend hospitalization. And then if you have a level over 4, that definitely indicates your horse has to go to surgery. It indicates a strangulating lesion that we cannot correct on the farm or with medical management. And if it's much higher than that, it's a pretty poor prognosis as far as survival. So that's definitely a good quick test to run, and anytime we see any red flags, we will run a lactate. So with that, if you do end up hospitalizing your horse and we do some further diagnostics, we might do complete blood count serum chemistry to check your horse's electrolytes, to check their, again, hydration status, organ function, and then blood gas is more if your horse goes to surgery. It's something that they'll monitor while the horse is under anesthesia as well and keep track of. So probably the most common one that we use is lactate. And the way the lactate works is if you exercise a lot, you start producing lactic acid. That's because you don't have oxygen supply to supply your muscles, so it has to go into a different form of metabolism. So lactate is an indicator of a lack of oxygen in the bloodstream. So what we're looking for is signs that there's something cut off from blood supply in the body. So when you have that intestine strangulated or twisted and cut off from blood supply, it'll cause the lactate to elevate because there's a lack of oxygen in the bloodstream. So that's what we're looking for. So some other diagnostics we can do. Again, a lot of these are for us to decide whether or not your horse needs to go to surgery or be hospitalized. So we can do an ab tap or abdominocentesis. That's where we stick a relatively blunt needle in through the bottom of the abdomen. And so we do a little incision in the skin, stick the needle through, not into the actual intestine, but just into the peritoneal cavity. And we're trying to get a sample of abdominal fluid. And there's a lot we can tell from that. You want it to be a light yellow straw color. If we notice blood in that, that indicates inflammation. If we see feed material in that, that's really bad. That indicates you might have a stomach rupture or an intestinal rupture. That's a bad deal. So, and we can also run a lactate on that fluid, and then comparing our blood lactate to our abdominal fluid lactate gives us an even better idea of prognosis. Again, if we're trying to get more information about what's going on and whether or not your horse might need to go to surgery, lots of times we'll pull out the ultrasound. So we can diagnose a lot of things on ultrasound, but probably the easiest to see is small intestinal volvulus or strangulation, because when you have a section of that small intestine twisted off, it will start to distend and get really round, and you'll get this almost honeycomb structure. So those are all distended loops of small intestine that aren't moving, the contents aren't moving around very well. So normally you want the contents of the whole GI tract to always be flowing, always be moving through. So if you see those big stagnant loops of small intestine that just aren't moving anywhere and they're completely distended, sometimes the walls are thickened, that's definitely an indication that you have that intestine twisted off. Okay, so getting into treatment. So once we've done our exam and our diagnostics, we'll typically sedate your horse. That's not just so we can pass a tube and do a transrectal exam, although it helps. It also seems to kind of break the pain cycle. So sometimes these horses will just cramp and cramp and cramp and get worse and worse and worse until you do something to stop it. So I never skip the sedation on a colic. Lots of times, to me, that makes the biggest difference on whether or not you can stop the colicking cycle. And then anti-inflammatory, so everybody has heard of Banamine for colics. Banamine, I think the biggest misconception out there is Banamine does not fix a colic. Banamine is not going to treat your underlying cause of colic. It is just a pain medication that's going to mask the pain. So it's just like you taking Tylenol or ibuprofen because you have a stomach ache. And it works great, but lots of times it can mask the symptoms for a couple of hours and then they're going to return. So Banamine starts to wear off at about the 4-hour mark, and if colic signs start to return at that point, it's definitely time to have your veterinarian out. We actually strongly recommend that you have us out at first before even attempting to give Banamine, again, because there could be a bad colic going on, and you want to try to catch those early. And then an antispasmodic, so a relatively new medication that we have on the market is Buscopan. This is from our friends at BI who are sponsoring us today. But Buscopan works great. It's a smooth muscle relaxant. So if you've ever had abdominal cramping, you know how painful that can be. And lots of times our colics are just that. They're cramping, they're gas colics, where really they just can't get relief because of the pain from the cramping. So Buscopan relaxes all that out and makes them feel a whole lot better. Again, you're not fixing a colic with Buscopan, you're treating the pain symptoms, but I feel it's an important part of stopping that colicking cycle. It works really well for us. I give all of those medications to every single colic I see. A few other things just while we're on the topic of Banamine. It's misused a lot. A 10 cc dose of Banamine is a full dose for a 1,000-pound horse. If you have a smaller horse than that, you want to adjust that accordingly. And that's a 12-hour dose. So if your horse does not respond to 10 cc's of Banamine, that doesn't mean you can give more Banamine. It can be extremely toxic. It can cause ulcers. It can cause right dorsal colitis. So definitely more Banamine is not necessarily better. Also, Banamine should never be given in the muscle. Don't read the bottle, listen to us. You need to either give it IV or by mouth. It works almost as well by mouth. So if you're not comfortable with IV injection, you can give it by mouth. But most importantly, call us and we will tell you exactly what to do. Did you have a question?
You answered it.
Okay. All right. And then, so another treatment that we do pretty much every time is nasogastric intubation. So like I said, that's a diagnostic where we check for reflux. It's also a treatment because if we don't get reflux, as long as we make sure that the stomach is relatively empty, we're going to put in electrolytes and water. So a lot of people ask me when they see me doing this, why are you using electrolytes and water instead of good old mineral oil? So mineral oil for a long time was the standby. So here's why. On your right here, we have a cup of mineral oil. And on your left here, we have a little bit of our electrolyte solution in water. This mixture of electrolytes was actually developed at UF, I believe. It's Epsom salt, white salt, regular salt, and baking soda. And you're trying to get a specific concentration of various minerals and a specific osmolarity to pull water into the GI tract. Epsom salt is also a laxative. So these are 2 fecal balls that were recently provided by our volunteer right here. And no difference between them. I have nothing up my sleeve. We're going to put 1 fecal ball in each solution. I'll even give the mineral oil a head start. And we're just going to let that sit. And when we're done here, come on up and tell me which one has dispersed the most. But I would argue that the electrolyte solution works a heck of a lot better for actually breaking up fecal material. So if you have an impaction and you want that to disperse, this is what we've had the most luck with. Mineral oil has a couple advantages. It will serve as a physical marker. So when you see mineral oil coming out your horse's butt, you know that the impaction has passed. But, you know, in my mind, that's about it. It's not actually going to treat the impaction very well, And it's going to make the whole inside of the GI tract extremely slippery, and it's going to make the surgeon mad at you when you send that horse for surgery. So the electrolyte solution I found does a much better job at it. So anyway, we typically give a bucket of water, about 6 or 7 liters, with that electrolyte solution mixed in, and we'll pass that into your horse via the nasogastric tube. But here's what we're doing. So we're going to put that salty liquid into your horse's stomach. And then the bloodstream has less salty liquid in it. You're going to cause the water to move from the bloodstream into the GI tract by osmosis, which we all learned in high school and thought we would not have to remember ever again. But that's what we're doing here. So salty fluid in, pulls water into the GI tract, makes everything nice and moist, and allows that impaction to slide on by. Okay, so some more intensive treatment. So, we've come out to the farm, we've given your horse the sedation, the anti-inflammatories, the antispasmodics. We've tubed your horse with the electrolytes and water. We've tested all the things, and your horse, and we leave, and then you call us an hour or 2 or 3 later and say, hey, my horse is still colicking. So now we need to go to some further interventions. The next level of management we're going to recommend is hospitalization here with some IV fluids. So that can basically lubricate the GI tract and rehydrate the GI tract a lot more quickly than oral fluids can. And especially if your horse has a compromised GI tract to begin with, they have an enteritis, they have an impaction, their GI tract is compromised, they can't absorb that fluid very well that you're putting into the stomach. So putting it right into the bloodstream is going to be a much more efficient way to do that. So IV fluid is definitely the best way to hydrate your horse. And again, most of these horses were dehydrated to begin with, which is why they got an impaction and colicked. And we'll talk about ways to prevent that here in a second. So some other things when your horse is on IV fluids, lots of times we'll supplement their electrolytes. So a lot of these horses are sweating a ton. They're losing electrolytes that way. Also, the IV fluids we use are pretty well balanced with salt, but they don't contain some other electrolytes such as potassium and calcium. So we'll supplement those in IV fluids, especially if your horse is on them for an extended period of time. And then some other advantages of having them here in the hospital and on IV fluids is we can add some IV pain medication to that. Sometimes if the medications we've given on the farm weren't enough, we can add ketamine, butorphanol, I was thinking of another one, lidocaine, as additional pain medication. Again, just to get them through the colic episode until they can pass whatever is causing the impact or whatever's causing the colic and start to feel better. And then, again, if you have a horse that has a small intestinal enteritis or obstruction, and you reflux that horse to relieve the fluid on the stomach, that might be something you have to keep doing up to every hour. So, if you have a GI virus, you might be vomiting very frequently, and since the horses can't do that, they need you to vomit for them by refluxing them pretty frequently. So lots of times those horses will keep a nasogastric tube in there, we'll tape it to their halter, and we'll just pull the fluid off of their stomach about once every hour. And it is pretty incredible the amount of reflux they can come up with. So I just put in small letters at the bottom, surgery. I'm not going to get much into that because I'm not a surgeon, but of course, if these interventions don't work, or if there's something that we found on our exam or our evaluation, like if they had an elevated lactate, if we saw distended loops of small intestine on ultrasound, if we saw a red flag in their abdominal fluid, if we felt something alarming on their transrectal palpation, then we will tell you your horse has to go to surgery. And when we tell you that, we mean it. It doesn't mean that it might get better if it stays here. It means surgery or nothing. And we always do our best here to do everything but surgery. But we also want to send your horse as soon as we can, because the longer your horse sits with an intestine, part of their intestine cut off from blood supply, the more likely it is that that section of intestine is going to have to be removed. And that carries a much worse prognosis for long-term survival. Okay, so what can we do to prevent dreaded colic? Yeah, so as I mentioned several times, we all believe that colics are typically caused by dehydration. You'll hear colics are caused by cold weather or changes in weather, and we totally agree. Any vet that's been practicing more than 3 days knows that colics happen when the cold weather hits, like these past couple days. But what we theorize happens is horses, when there's a cold snap, they don't feel like drinking as much. So they get dehydrated, and as a result, they colic. So it's all about water intake, and as the saying goes, you can lead a horse to water, but you can't make him drink. Well, some tricks that I think are great just to get water into your horse is soaking things. So soaking alfalfa cubes, really, really soupy. Soaking, doing a bran mash. Soaking alfalfa pellets or Timothy pellets. Soaking beet pulp. Not that I think that bran mash or beet pulp has much nutritional value. It's mostly just fiber, but it's a great way to get water into them. So if you're doing that with your horse, I would tell you just keep on doing it, especially through the winter or through any weather changes. Great way to force them to take their water in. You can also just soak their grain. I mean, if your horse doesn't mind, a lot of people soak their horse's feed every meal, 365 days a year. So if your horse will eat it, I always encourage that. Horses need to drink about 30 liters a day. So that's like the 6-gallon water buckets you buy at the feed store. It's about 1 1/4 to 1 1/2 of those buckets. So that's quite a bit of water. I mean, think about 15 2-liter Coke bottles. And that's just to maintain. So that's not accounting for any losses. That's not accounting for any sweating or, if they're exercising. So that's just maintenance level. They need 30 liters a day. So anyway, lots of water. And if they don't get that water and they get dehydrated, they are likely to colic. Another way you can encourage them to drink is just a little bit of salt on their feed. Again, if your horse will tolerate it. You don't have to go, online or Tractor Supply and buy the expensive electrolyte solution. About a tablespoon of table salt will do it. Has the same effect. You can, it tastes salty. It will encourage them to drink. Just plop it on their grain morning and night, and that will just encourage them to drink a little bit more. So we're going to talk a little bit about diet. Coastal hay is definitely associated with impaction colics, as Dr. Abbott mentioned. It's a proven fact. However, the majority of our clients feed coastal hay. The majority of people in Florida feed coastal hay because that's the kind of grass that grows here. That's the kind of hay that's most available. And most horses do fine with that. What we recommend you do is add in a little bit of alfalfa or peanut hay and about a 1-to-4 ratio. So for every flake of coastal, give about a 1/4 flake of alfalfa or peanut hay. And that works because alfalfa and peanut hay are legumes, and they have laxative effects in the horse's GI tract. So it'll keep that coastal hay moving through. Ideally, I'd recommend you spread it out through the day. So I'd recommend you add a handful of alfalfa in the morning, a handful of alfalfa at night. You can also use alfalfa pellets or cubes, works just as well. But add some alfalfa or peanut in with your coastal hay to prevent those impactions. Feeding straight coastal hay, free choice on round rolls, those are definitely the most common situations where we see impaction colics. And, you're not going to prevent every single colic by doing that. You're not going to completely prevent colic if you never feed coastal hay. I'm just telling you that it's a fact that we see more impactions with a straight coastal hay diet. Grain, I don't really have any recommendations. There's not one type of grain that's more likely to cause colic than others. Again, if you can soak it, that's a plus because you're getting more water into them. Yes?
And when it's cold like this, I take a gallon of water, put half or a third, 3/4 of a cup of my grain in it, let it dissolve, stir it up, and they drink it down. And when it's really cold, I do that at least twice a day.
Yep, that sounds perfect. As much water as they'll tolerate is great. Some horses are a little picky. Some horses don't like their grain soaked at all. Some horses will take it when it's mushy, but not when it's soupy. And also be careful about letting your soaked grain sit too long because it gets a rancid smell pretty quickly. So I would soak it right before feeding it if you're trying it for the first time. Okay, so other things we can do for colic prevention. Like I said, water and diet and hay are the main things, but You also, especially in your young horses, as Dr. Abbott mentioned, so this is like your 2 and 3 year olds, you want to make sure you deworm them appropriately. And that is starting at about 3 to 5 months of age because of these ascarid impactions. So these are the roundworms, the ascarids. Really gross. Sorry for the gross picture. This is like the least gross one I could find. They are disgusting. But yeah, it kind of looks like an upside down pineapple coming out of the intestine. Anyway, so you want to make sure you deworm your horses appropriately, those babies, because they can get these ascarid impactions. By the time they're over 3 years old, they pretty much develop their own immunity against the roundworms, so you don't have to worry about it as much. And just as a reminder, for our adult horses, we only recommend deworming once a year. So we're just talking about babies here. So you have to, again, start deworming early, because another risk is if you have not dewormed your baby, or say you purchase a 2-year-old that has no deworming history, and you hit them hard with a dewormer, the die-off of these parasites can also cause an impaction. So again, deworming them appropriately from a young age is really important. And then another preventative thing you can do is the dental care. So horses chew in a grinding motion like this, a circular grinding motion. And if they get a wave or a step or sharp hooks or points, they can't grind like that. It gets stuck. So it affects their digestion, because again, part 1 of that GI tract is the mouth, as Dr. Abbott mentioned. So it all starts there. If they can't chew or masticate their food properly, they're more likely to get an impaction or choke. So starts at the mouth. Definitely get your horse's teeth checked. We recommend an oral exam, plus or minus float, at least once a year. So another thing that I'd say we all just kind of have learned over the years is horses do well with a consistent routine. You know, if you have a house sitter coming over, I wouldn't necessarily tell them, hey, you don't have to feed the horses, or you can just throw them hay once a day. Try to keep the routine consistent. Horses are creatures of habit, and the horses and their GI tract will get accustomed to that type of feeding schedule. So try to keep it consistent. And horses, you know, remember, are grazing animals. You know, in the wild, they would be out on the plains having to forage for food all day. They would be eating small amounts of grass throughout the entire day. So that's how their GI tract evolved to work, is slowly and gradually over a 24-hour period. So when we stick them in a box and feed them one huge pile of grain once a day, that really is putting a lot of stress on their GI tract, and it's not how they are meant to eat. So even splitting your horse's feedings into twice a day is much, much better. But if you can give them multiple smaller meals, that's even better. Again, providing them with forage throughout the day, so giving them some hay to munch on in between their big meals. If they are a horse that, you know, is showing or for some reason has to be kept in the stall 24/7, it's fine to give them grain morning and night, but give them something to munch on in between. Because again, you don't want the GI tract sitting empty and then getting filled, and sitting empty and getting filled. You're going to run into problems such as ulcers, and again, you're more likely to have colic. So spreading out their feeding over a longer period of time as much as you can, keeping the routine consistent, deworming the babies, and having their teeth checked once a year.
How often do you deworm a baby?
Yeah, so we recommend 3 to 4 times a year for the 1, 2, and 3-year-olds.
Okay.
Yeah. And we did do a talk on deworming that you can find on our Facebook page if you would like to get more information on that. Yep. All right. So those are all the tips and tricks that I could think of to share with you guys, but does anybody have any questions? Yes.
Shoot, on the, if you got a horse kind of colicking and you're getting a bucket of water and put a little feed in there, hoping they'll drink it, would it be good because of the electrolytes, maybe to put a couple scoops of stress sticks in it?
So if the horse is already colicking?
Yes, if they're already colicking.
Yeah.
Yes.
Yeah, I don't see much benefit to giving electrolytes to horses once they're already colicking. Again, the electrolytes are more of a preventative thing to encourage your horse to drink, but once they're already dehydrated, if anything, I would think it would have the opposite effect. Yeah, so, you know, drinking is always good, but I wouldn't necessarily give electrolytes to an already colicking horse. by their feed.
Okay. And the Banamine, which is the quicker onset, the oral or the
IV.
IV?
IV is faster onset. Yep. Yep. Slightly more rapid onset, but it's really less than 30 minutes if you give it by mouth as well. Especially if you use the Banamine paste, that's formulated to be absorbed through the GI tract, and they do a pretty good job of making that. So.
Quicker on the paste even?
Right. Yeah. Yeah. Yes, in the back.
My interaction with donkeys, are there any specific differences for the donkeys?
Donkeys in general are pretty hardy. They might be a little more tolerant of the forages. You know, a donkey is the only animal I've seen a gastric impaction on. So, you know, just as anecdotally, maybe that's something that happens more in donkeys. But yeah, otherwise we treat them exactly the same. Yep. Yes, here in the front. Yeah. Yep. Yep, there's baking soda in this mixture right here. So, or maybe I forgot to add that in the list. Epsom salt, light salt, regular salt, and baking soda. That's our mix. Secret recipe that you can also find online. Yes.
Are there certain horses that just have like a predisposition for colics, or you know, is there a certain type of colic if they have it once, you can expect that it'll come again?
Yeah, very good question. So when we see a horse that's having recurrent colics, and by that I mean several times in a year, we start to think about things that are not the true colic. So things like ulcers, stomach ulcers, can cause signs of colic, but of course they don't actually have an impaction or a twist or something that would require surgery. So again, you know, I would look at your horse's diet and lifestyle, but then also we might recommend doing a gastroscopy or stomach scope to check for stomach ulcers. That's probably the most common cause of recurrent colic that we see. And so other reasons for recurrent colic, anytime your horse has colic surgery, they're going to be much more likely to colic again in the future. So where that incision on their abdomen was closed up, they can develop adhesions, and that's going to be a risk for the rest of their lives, especially if they had to have a section taken out. That section that was sewn back together is going to be at high risk for having, again, adhesions or getting a blockage at that location as well for the rest of that horse's life. So I'd say previous colic surgery is definitely a high risk factor, and then GI ulcers is another thing we think about. Yes, sir.
Have you all had any experience with some of the hindgut buffers for colic-prone horses?
We don't use them very much just because we don't find that the research is really there yet. Now, Purina, especially off the top of my head, and lots of other companies are doing a lot of research, especially on probiotics currently, but the challenge is getting those probiotics to survive the horse's digestive process. So things that you feed orally first have to survive the stomach, which is extremely acidic in horses. They have to get through that 70 feet of small intestine. They have to get past the cecum and into the hindgut. So, you know, based on the testing that's been done so far with like cannulated horses that have their cecum cannulated, so you can take a sample out, those probiotics and other hindgut treatments aren't really getting there.
I was thinking about the Epicure markets a product that claims to buffer the pH in the hindgut.
Yeah,
supposedly it doesn't break down until it gets there.
Supposedly. I would argue that the research doesn't stand behind those types of products yet. I think they're getting there, but I don't think the research stands behind them yet. Yes.
Sorry. The hay, when we had no grass at all, I would hay them in the pasture, and I had a friend, you need to keep hay in front of them all the time. And I don't do round bales, I do square bales and take it out there. But I would twice a day out in the pasture, because you don't want hay in front of them all. My mare would eat continuously. I mean, she's just a schlubby.
Yeah.
So, should you let them have it all the time or regulate it?
Yeah. So with overweight horses, that's definitely a balance you have to think about, is feeding them 24/7 to help their digestion, their digestive tract keep moving versus giving them too many calories. Like somebody mentioned, I would definitely recommend a slow feeder or slow feeder hay net. Just helps them slow down a little bit so they have something to pick on throughout the day. Again, they don't need a lot, just small amounts through the day. So, you know, if you were home all day and had nothing better to do, what you might do is go out once an hour and give your horse a quarter flake of hay. But, you know, that's not realistic. So, you know, do your best within reason, but without actually increasing the total volume your horse is getting in a 24-hour period. Yeah. Yes?
Since my horses are on round bales with the slow feed hay net,
Yeah.
they get alfalfa cubes at night that are soaked. Should I give them some alfalfa pellets or something in the morning as well?
Yeah, I would recommend that the ideal would be to give them some alfalfa in the morning and some at night. So either split up your cubes morning and night, or give them, you know, some additional in the morning.
Because we weren't, before we did the slow feed bale, I would go out and just give them, you know, a bale and a half of hay a couple times a day. So I had a youngster who was out in the pasture with not a darn worry in the world developed ulcers just because he wasn't getting enough forage. So we switched to the slow feed buddy bale and never had any issues.
Yeah, and definitely, you know, GI ulcers are one of the biggest reasons that ideally you want to keep some forage in front of them all the time, because it doesn't give the stomach a chance to sit empty and just build up straight acid. Because the stomach is consistently producing gastric acid, so if you don't have any forage in there to buffer it, they're more prone to GI ulcers. Yes?
Is it true that the stomach empties in about 15 minutes?
You know,
and everything is already, you know, moved out in 15 minutes and it's going through the rest of the digestive process?
it's going to depend on a lot of things, such as size of the meal and the individual horse and whether or not they have any predisposing issues. I will look that up for you, but I think it's a bit longer than that. Yeah. The whole digestive process takes a long time to get through all of that length. So yeah. Yes.
Is there any concern when your horse is on pasture and then you go to show or somewhere different, similar grass, but it's not at home,
Right.
as far as them reacting to that differently?
Usually grass is pretty safe. Grass has a pretty high moisture content, and it's really unlikely for horses to colic on grass, basically. So yeah, in general, you're pretty safe. Yeah. Yes.
About how much hay pellets would you add for, say, 1,000-pound horse if you're feeding those?
Yeah, so I would do about a scoop, 3-quart scoop or so. In my mind, that's equivalent to about a half a flake of alfalfa. So about a scoop a day. So I'd have to weigh it. Hay pellets and cubes are pretty light, but about 3 quarts in volume. Yeah, of pellets or cubes. Yes, in the back.
I had a couple of questions about psyllium fiber. Do you think that's an effective way to prevent sand colic?
Yeah, so I definitely don't think it hurts. The most recent research is that to actually clear a true sand impaction, the horse has to be tubed with psyllium for about 4 days consecutively to clear a sand impaction. I mean, either that or surgery. So I don't know that if you already have a sand impaction, if just feeding psyllium is going to do it, but I definitely recommend it preventatively if your horses are on a sandy environment. Moving through. Yeah, I think Sand Clear and similar products are great. Also, the hay itself will help to do that. It'll kind of rake the sand out of the intestine.
I had a question about the method. Their feed is always soaked.
Yep.
And I do the psyllium 1 week out of the month.
Mm-hmm.
I don't know if the feed being wet might reduce the effect of this or the psyllium, so I always wait till the last minute before I feed it to them, and then I put the psyllium pellets on top.
Yep, I wouldn't worry about the moisture. As soon as it hits the mouth, it's going to get wet. So, yep, shouldn't inactivate it. You're good. Yes, here in the front. Good. She's staying in the hospital with us for 1 more night. That's Midori. And she had to donate some fecal samples for us. Yeah, be sure to sneak up here afterwards and see what you think. But it looks to me like in our mineral oil, we've still got a nice, solid, completely formed fecal ball. Hasn't moved much. And in our electrolyte solution, it's just about dissolved. And I don't think I've been talking that long. So you guys can decide for yourselves. Yes.
Do you have an opinion on jig hay versus Tipton?
On what was the question?
Jig hay versus Tipton hay?
I don't know that I'm familiar with that first.
Bermuda.
Just Bermuda? Yeah. Okay, so Tipton is a slightly superior version of coastal hay, but you have to realize it's still a coastal hay. And I would say that all of the rules still apply that I previously mentioned as far as adding alfalfa or peanut to it. Yeah. Yes, in the back.
Quick question. I feed mine Bermuda donkeys, and as soon as I get the first frost, I start feeding Bermuda all winter long, and then they get back to the her question and the other question about double diets, am I getting more harm than good?
No, I think that's one case where you're fine to switch, and you know the horses will kind of do the transition gradually themselves. So once the grass starts to come in, they eat more grass and less hay. And usually by the time you're pulling the round bale out or by the time you're moving them to a different pasture, they're not really eating it anyway. So they're doing the gradual transition themselves. I wouldn't worry about it too much. And yeah, you have to supplement hay in the winter when the grass is dead. I mean, what else are you going to do?
I don't know the pre-feed anyway. I do measure milk, so I know they're taking just like the water. I don't know all the water feeder. I want to know they're taking.
Yep. Yep, I think that's just fine.
Kind of the sciencey part of it.
Yep. I think we'll hold off on questions there. If you guys have further questions, feel free to find myself or Dr. Abbott, or I think Dr. Latcher is around here as well. Oh, she's not. But myself and Dr. Abbott are still here if you need help. And we're going to go ahead and do the drawing for the BI raffle that was so generously donated by the people at Boehringer Ingelheim.
Yes. So thank you all so much for coming out. And Stacy from BI is in the back. So thank you so much for tonight and giving us a wonderful goodie basket. Dr. B, would you like to draw a number?
If you insist. Okay. 1, 6, 4, 8, 5,